My name is Sadaf. Today I will be presenting a patient-centered teaching plan simulation meant to convey the importance of weight and associated BMI management to a patient diagnosed with type 2 diabetes. Seen here is the patient profile. His name is John. He is 57 years old. He has a 5-year history of type 2 diabetes, and 2 years prior to that diagnosis, he experienced persistent hyperglycemia or elevated glucose. He currently weighs 100 kilograms and is 180 centimeters tall, which makes his BMI abnormal at 30.9. As such, his weight status will be classified as obese. The body mass index can be easily calculated. Here I have referenced the CDC website where I calculated John's BMI, and this can be demonstrated to him, and he can easily calculate it himself as well. So this is the beginning of the simulation, and I will now pretend that a nurse named Sadaf is communicating with John. Hi John, my name is Sadaf. How are you today? I am good. How about you? I am good, John. Thank you for asking. Do you know why you are here today? Yes, the docs told me that I better get my weight down since I have type 2 diabetes. That is correct, John. And in order to do that, me and you are going to follow a teaching plan specifically designed to achieve your weight loss and maintenance goal and objectives. We will start with a statement of the overall goal and a list of objectives. So let's go through objective 1 now. You don't have to understand everything in these images that you see, as I will summarize them for you. In type 2 diabetes, there is a reduction in target cell responsiveness to a hormone called insulin. Target cell here just means where the insulin is supposed to go to perform the function it normally performs. So what is the function of insulin? Well, insulin is a hormone naturally produced by beta cells in the pancreas, and it helps cells absorb glucose, and then this reduces blood sugar and provides the cells with glucose for energy. Now, when blood sugars are too low, the pancreas, another cell called alpha cells, normally releases another hormone called glucagon. Glucagon tells the liver to release stored glucose, which causes blood sugar to rise. However, in type 2 diabetes patients such as yourself experiencing persistent hyperglycemia, which is increased glucose most of the time, this is the consequence of reduced insulin activity. A lack of insulin hampers the ability of the glucose to enter these cells, which tricks them into behaving as if the glucose level is lower than it actually is, which in turn stimulates the release of glucagon. So you don't have to understand everything that's going on in these images, and I've included some definitions for you, which you can review. I'll send those home with you. Just need to understand the difference between the normal and type 2 diabetes physiology or effects in the body. So lifestyle plays an important role in the development of adult type 2 diabetes. As you can see on the chart, we have a section obesity is leading to some physiology changes, with a sedentary lifestyle and obesity promoting development of the disease. So type 2 diabetes can usually be controlled or even reversed through weight reduction and exercise, which will increase insulin responsiveness to tissues or the cells that we've mentioned here. In type 2 diabetes, if interventions like lifestyle changes that we talked about are not implemented and glucose remains uncontrolled, blood pH can drop, which can depress the central nervous system function, ultimately leading to coma and death, which you see over here. Now, that's the absolute worst case scenario, but that can happen. So the other effects that can happen, I've included definitions here, but I'll go through what other body organs can be affected. So your eyes, and specifically your retina, can be affected, your heart can be affected, your kidneys can be affected, and your arteries and nerves can be affected. Okay, John, now I'm going to ask you to complete this short and easy quiz. Great, thank you so much. Was that hard? No, but it was funny. Yes, wouldn't we all want to have Dwayne Johnson's physique? Good work, John. You got them all right. That means we are doing something right. Okay, John, now we have returned from our short walk. I'm now going to show you a few exercises. Please follow along as best as you can. Afterwards, you can pick the ones you like and can perform them safely. Repeat them for me and incorporate them into your daily exercise regimen. For each exercise, we will do 1 set and 10 reps together, and then you will do another set. The first exercise is squats, second is wall push-ups, third is overhead presses, fourth is knee curls, and the last exercise is floor back extension. Good job, John. That was great. Let's cool down now with a few stretches. Always remember to start your exercise with a short, brisk walk to warm up and end with stretches. Here are some sheets to note down your exercises and check off as you do them daily at home. Okay, John, now we are going to participate in a group discussion. All the patients here have similar goals and they are all experiencing type 2 diabetes. I will start the discussion with a question. We will go around the circle and everyone can respond to the question once. Then we will go around the circle again, but this time you are asked to make a comment regarding something that your peers shared. Please remember to listen to your peers attentively and respectfully when they are speaking. How do you feel about your current level of physical activity and food choices? John: well, I don't have much energy to, go to the gym, and as for food, I pretty much eat out every day because I don't know how to cook. Ting Chen: I hear you. After years of paying for the gym membership, I just canceled it. I do, however, go for walks and have started to take the stairs at work. My food choices all day are pretty good, salads and fruits, but when I get home after a long day at work, I like to snack on chips. Nadine: I recently started following YouTube exercise videos, but I am not very good at doing the workouts daily. But I must say, I feel 10 times better after doing a workout. I have a bit of a sweet tooth and probably eat more sugary stuff than I should. All right, thank you everyone for sharing. We will now go around once more and each of you can share how you feel about some of your peers' responses. John: Ting Shen: I love chips too, but I think it's great that you eat lots of salads and fruits. I need to do that more. Nadeem: what a great idea, following YouTube exercise videos. I will try that. I really should start exercising and eating better. Great job everyone. Thank you for listening and sharing. All right, John, that's a wrap. How do you feel about your session today? Pretty good. Do you understand the importance of maintaining a healthy weight with your current diagnosis of type 2 diabetes? Yes, I understand that weight reduction through exercise and better food choices can actually fix in my body what's going on because of this diabetes I have, like high glucose and insulin not working. Weight loss can also prevent other problems with my heart, kidneys, eyes, and skin. That's great, John. Here's a summary sheet of our session that you can review at home. Have a wonderful day. Here are some additional references that were used in the designing of this learner-centered teaching plan. Thank you for watching.